You're muted.
Muted.
Christian, we apologize.
Let's go. Good afternoon, everyone, and thank you for joining us for this week's Facebook Town Hall, where County Board Member Takis Karantonis and I, Christian Dorsey, will be discussing things related to COVID as well as other important events in our county. This week's discussion comes as case numbers for COVID continue to rise in our county and throughout the state. And we have to be especially mindful that with high-risk opportunities like Halloween and Election Day coming up, that we have to be especially mindful not to relax behaviors that we know will prevent the spread of COVID-19. Things such as staying home whenever possible, making sure we maintain physical distancing of at least 6 feet when venturing out, and wearing face coverings. Most importantly, wearing face coverings whenever we think that physical distancing will be compromised. COVID-19 is not going anywhere anytime soon, as the ongoing rate of cases shows. We know that everyone is very much needing to get back to some semblance of normality. But if we're going to maintain an approach that allows that to happen while ensuring that the health effects of the pandemic don't overwhelm individuals as well as the healthcare system, we need everyone to be committed and vigilant to doing the things that are necessary. And I know with Halloween coming up, there are many people who are interested in understanding what they can do in order to celebrate the holiday. While it's not an official sanctioned county holiday, we have provided health guidance on how you can practice enjoying your Halloween revelry in a way that comports with good public health practices. So we have heard creative solutions from people who are going to have costume parades and scavenger hunts with families. There's going to be a great deal of creativity in making sure that this can continue to be a fun holiday, even if it's not celebrated in the traditional way. So today we have subject matter experts from the county who will be available to provide some key information and to help us answer any of your questions. Joining us are Dr. Ruben Varghese, the Director of Public Health, Dr. Aaron Miller, who is the Director of Emergency Management. And because of events and news going on in the county, we've asked Samia Bird, our Chief Race and Equity Officer, to also join us for today. As far as the overall effects of COVID, you should know that in Arlington, our positivity rate, the rate of COVID cases for all of the PCR tests performed, is somewhere around 3.4, 3.5%. It's been on a steady downward trend for the last several months on a month-by-month basis. That's good news. But of course, it means we still have spread in our community. So to help us understand the path of this virus and our efforts to combat it, we will hear more details from Dr. Varghese in a moment. But I'd now like to turn it over to my colleague, Takis Karantonis, to talk a little bit about some of the other things that are going on in Arlington. And Takis, I believe you're muted, sir.
Here.
Perfect.
Thank you so much, Christian. I forgot to unmute myself. I apologize for that. So good afternoon, everybody. Thank you for joining us this afternoon. We are talking about COVID, but as my colleague Christian Dorsey mentioned, we can talk also about other related issues that are going on in our county. And as we all know, in this period of stress, during this period of stress, we, as a community, we saw that we have a lot of unresolved and still ongoing need for the equity to discuss the equity issues. So this continues to be our focus in the county. And this very last Monday, we launched the county's dialogues on race and equity. There is a short DRE, which was created for Arlingtonians to collectively address racial equity and disparities in our community. And it follows a commitment that was laid out in the board's 2019 equity resolution. Christian Dorsey is with us. He was a leader with that. And I'm very happy also that Samia Bird is joining us today to talk about this. As part of this effort, there will be an assessment of current beliefs in the community. The assessment is intended to gain insights about how members of how Arlingtonians, members of our community, perceive race, how they perceive equity in Arlington, and moreover, we want to be able to gain insights about what is really important and how we move forward in changing, for example, the logo and insignia of our county, and how we consider and think about the process about renaming streets and other Arlington County facilities. We also encourage everyone to sign up to participating in this DRE process in our community. There will be a series of serious virtual conversations about race and equity and all related systemic issues. In addition, DRE Together invites local nonprofit organizations, civic associations, faith organizations, businesses, and other community stakeholders to join us as partners. The greater the participation, the greater and deeper the impact will be. Also in our efforts for a more equitable Arlington, we launched a couple of years ago, Destination 2027. That was prior to the arrival of the pandemic, of course. And this was really about health equity. So we found out, and if you read the report, that we have significant issues still to work on there. So collectively, the decision makers in our government, for-profit and non-profit sectors are currently working with the goal to change the conditions that make that our neighbors, our community experiences this health disparities and eventually achieve health equity in Arlington by the year 2027. So today, Dr. Varghese will share some additional data that are related to COVID specifically and health equity. So we are also part of, I should say, of our state's health equity pilot project, which aims to provide testing and information to communities that are disproportionately affected by COVID. And we will see shortly which communities are these. Maybe back to you, Christian.
Sure. Indeed, and thank you, Takis. Our public health staff are also continuing significant efforts in ensuring that we can trace every case of COVID that presents in Arlington. This is an important way that we are able to control the spread by determining who needs to be isolated as a result of close contacts with people who are positive and who needs to be in quarantine. It's a pretty sophisticated, effective effort, and we encourage everyone, if you were ever called, to answer that call from a contact tracer, because your participation, your full, frank participation, is essential in controlling the spread. There are lots of other areas that we're involved in, but we should get to the questions because a lot of them are coming in through text and through Facebook Live. And if you have a question that you'd like to text, you can use the number 571-348-3053, and we will endeavor to get to as many questions as we can during our time today. I will remind you that we will likely not ask questions exactly as written, but try to aggregate as many as possible and hope that the information that we convey is responsive to what you're interested in today. So why don't we start with Dr. Varghese, just giving us a real concrete overview on the health metrics and important considerations as you continue your efforts helping Arlington navigate this pandemic.
Thank you, Mr. Dorsey. It's a very important thing to do. I don't think it comes as a surprise. We are still in a pandemic. We still have community-wide transmission. Aaron, if you could share your screen for that slide. I apologize for the camera angle. The computer's acting up and I'm on my phone device. So I think many of you have probably seen this before. This is, once again, the distribution of cases of COVID since the very beginning of the pandemic. And we've never left the community transmission phase. We reached a peak in May, but as you can see, after reopening at phase 3, we've had a steady rise, or steady band of cases, maybe not as high as between phase 0 and phase 1, but it's still disturbing that we have this much transmission, which is why we continue to ask people to stay home as much as possible and to wear your face coverings and keep 6-foot distances. We have seen some increase in cases in the last week. We'll have to see if that's something that's going to continue, but that's the fear, especially as we continue to gather together. Connecting this to equity, I want to make sure that we were able to have staff actually present something similar to this instead of age distribution over the pandemic, the rates by race, ethnicity. And Aaron, if you can go to the next slide. So to orient people, once again, the y-axis or the vertical axis is the case rate, and which is the number per 100,000 over that entire time period. And the horizontal axis or the x-axis, we once again have the data by week. And just so that people, if they're not sure what the colors are, the orange line, it represents the Hispanic or Latino population. The dark blue line is the Black or African American population. The blue line is the Asian population, and the purple line is the white population. And the black line and the gray underneath it is the overall experience of Arlington if everything is combined. And that's the thing that you should look at as almost like the baseline. If that's our community average, from an equity perspective, I don't want anyone to have the illness or the germ. But if we're thinking in equity, we would never want, when we disaggregate the lines, for it to look any different than the average line. And yet what you look at this is clearly the Hispanic or Latino population throughout this time period has been disproportionately affected, experiencing infection. And then the next group that is affected are the Black or African American population. Several times throughout this, most of the pandemic, they've been above the average experience in Arlington, and they've been consistently above the experience of the white and Asian American population. So this is just another way to represent the experience of germ spread, and the likely reasons for this are also embedded in some of the community conditions that we as a society have differentially allowed for. And so some people, have the benefit to be able to stay at home during a pandemic, and others do not. And in exposure terms, if you can stay at home, your risk of exposure to the germ is much lower as a general rule, and that includes your whole household compared to if you've got people having to go out because they have, they're in essential jobs or they're the primary breadwinner and their work requires them to go out. So I think this is just another way to talk about equity, and it's a great launching point for discussions about DRE and so on. So I'm happy to answer any questions.
Well, thank you, Dr. Varghese. We do have a number of health questions related to you, as always, during these town halls. So we'll be back to you in a moment. But how about for the next question, Mr. Karantonis?
Actually, I wanted to ask something, Dr. Varghese, because I think it's important to reiterate that what does exactly mean that we are in the area of still having a spread in the community, and what is this famous number of, is that still 50 per 100,000, 50 cases?
Great question. There's no specific number that we're looking at, as much as when you look at those curves, you see that infection is occurring and it continues over time. The definition of community transmission really is we have an outbreak, but we can't actually determine the source of almost everyone's exposure. Just because yes, in a household, if the person comes from outside and brings it in, we know the source in the household. The problem is we cannot pinpoint where the source is for the person that went outside. Typically in outbreaks, you can do that, but with a pandemic, it's everywhere. And until it gets back to discrete context, that's the real issue. So a specific number is not as appropriate as can we identify the source of infection and then actually further contain it.
But anyway, thank you. I just wanted this to be reiterated because I think it's important to understand the term. So you talked and you showed us this very impressive data, impressive in a concerning way. I should say that certain neighbors of ours, Hispanic and minority neighbors, Black Americans, are really disproportionately, sometimes really very disproportionately impacted by that. So we spent some time talking about equity this afternoon. So Samia Bird is with us, as we mentioned at the we offered initial remarks, and she is leading our efforts for the dialogues on race and equity, which cannot be, they are really framed inside this COVID discussion as well as everything else. So maybe Samia can offer some insights about how these dialogues will roll out and what Arlingtonians can expect.
Thank you, Takis. Yes, as has been mentioned, we certainly have seen everything going on with the pandemic and the data that we just saw about the impact of the virus on Black and Brown populations, and then also all of the racial injustice that we've seen being protested around the country. It's really been a really interesting year where a lot of things that we've known to be true for many, many years, and the racism that has been present for centuries has just become more front and center. And so with the dialogues on race and equity, I want to say that a lot of our work actually not only began to be prioritized with the resolution of 2019, but, as mentioned before, the Destination 2027 work, we've been committed to focusing on equity. And so these conversations really give us an opportunity to continue to advance and build on that work. And what I think people can really expect is that we want them to be involved in facilitated discussions with their neighbors and partners to be able to share, learn, and really understand our experiences related to race and racism and how we show up and how we've been impacted by racial disparities and inequities here in Arlington. And we only get to do that when we are in dialogue with one another. So we're looking for these conversations to really help us to build a foundation to be able to discuss and share what the issues are, our experiences are, and how we can together talk about what we do to move forward. We're not going to be able to necessarily get to solutions until we can be able to even begin to have conversations and really normalize the discussions around race and racism, and in particular in Arlington and what that means for us as a community. And so people can expect to be involved again in these facilitated conversations across races, which we really encourage as many people as possible to participate, regardless of where they are on the journey, because that's how we learn from one another to know where and how we can move forward. And so as we roll them out, we're going to have conversations at a high level, community-wide, that will be facilitated. And then we're looking to partner with organizations who can be trained and have facilitated conversations with their stakeholder groups as well. And we want everyone also to take the assessment, which is going to gauge perspectives on race and racism in Arlington. And then we're looking ultimately to be able to have a toolkit that people can pull down to have conversations with neighbors, with their families, with their friends. We know that talking about race is challenging, it's difficult, it's hard, and we want to be able to give people tools to be able to have the conversations that are needed for us to move forward together as a community and advance efforts in this space. And so ultimately, what we hope to do is take all of the information that we hear, all of the conversations that are had, roll that up into a report that provides input to the and feedback to the board on just where we are as a community and sets that baseline so that we can start to think about what some next steps might be.
Perfect. All right, so before we move to consideration of the questions that we have, just Dr. Miller, I wanted to give you an opportunity to share with the community some of the things that we have done to address the COVID data based on race and ethnicity that Dr. Varghese spoke to before, some of these specific areas where we've tried to address the gaps.
Sure, and thank you and good afternoon, everyone. You may have remembered that we talked a few weeks ago about participation in the Governor's Health Equity Project, and you had some members with us today talk about that as well. That's a three-pronged approach, really, and that three-pronged approach is based upon a principle in public health called the social ecological framework, and it relies on us figuring out how we can impact individuals at the individual level, at the family level, and also at the community level. And so there are strategies that really work across those three levels. And a number of the policies that you hear about in these weekly town halls or biweekly town halls are designed to help complement that. And so I'll give you an example. First and foremost, it's PPE distribution for us. So we partnered with the Arlington Public Schools using the data that Dr. Varghese, epidemiologist, provided. We're able to identify about 11,000 individuals within APS schools who were in those areas that met criteria for being most at risk for exposure. And we did that by identifying where case rates were high, where there were large multifamily dwellings, and also where we had workers who, for instance, were in the service industry. We know that that exposure risk is a little bit higher. And so those 11,000 PPE kits went out to APS families, and it included face coverings, it included hand sanitizer, and it included multilingual information in both Spanish, English, and a few other key languages for Arlington on things like where you can get tested, a refrigerator magnet that had the Arlington County COVID hotline number on it, information about rental assistance, as well as information about food assistance that the Department of Human Services has been offering and that you've heard about in some of these town halls. Second prong is expanding access within the testing sites we already have. And so you heard about it last time, the expanded hours at Arlington Mill. So just as a reminder, Arlington Mill is open Monday through Friday, 1 p.m. to 5 p.m. on the second and fourth Saturday of each month from 1 to 7 p.m. So we extended those hours because we learned that one of the barriers was that people have to work, right? And we need to be able to reduce those barriers to make sure that folks can get there. We're also open on the first Saturday of every month from 8 to 12. There's no fee, no appointment, no government ID is required. We only ask for proof of identification. So we just have to be able to match you to be able to say this is who we're sending test results to because it's medical information, but that doesn't require a government ID. And there is no fee in partnership with the Arlington Free Clinic and the Virginia Department of Health at Arlington Mill. So that's sort of that second prong, right? Reducing the barriers. And then the third and final one is expanding testing opportunities. And you heard me talk about that. And that is the what we're calling mobile or pop-up testing that goes into the community, into neighborhoods that are identified as having higher case rates, and making that accessible for those residents within the community by putting it in those locations, easy to access from transit, key community locations. And we've been doing that in the Green Valley as well as the Buckingham neighborhoods. Those are pop-ups 2 times a month on Saturdays. And the last one that we just held had 294 individuals come through, which was great. You know, it's right about what we expected the demand to be. And what we're seeing is a lot of great outreach into the community to be able to make them aware of those services, and no appointment necessary at that, offering translation services and doing that as a low barrier test using a saliva-based test instead of the nasal swab, because we know that that can be a barrier to some people wanting to get tested.
Thank you. So, Taka, should we move to the questions?
Absolutely.
Okay.
Dr.
So-
Miller, just a clarification, if you can. Or are underinsured, correct?
Yes, I'm sorry, you froze there, Mr. Karantonis. You froze for a second, so if you could just repeat the question.
The question was just a clarification. Arlington Mill is free and available without referral. People have just to call in to make sure that they get a slot. For those residents who are not insured or are underinsured.
That's correct. Yeah, excellent point. As a part of the access problem, we wanted to make sure that that specifically is designed for those that are underinsured or uninsured. You're absolutely right.
We have our testing center on Quincy Street that is for the folks who are insured and can access the service, the testing service there. Correct?
Absolutely. Yes.
Absolutely. So I have a question here. I think this is very timely because holidays are closing in, and especially I'm especially worried about Thanksgiving, actually. So the question is, are there any updates of or on if there will be changes to the requirements to get tested as holidays are coming up and people go visit family? It'd be great to be able to get tested as a precautionary measure. What do we comment on this?
Sure, I'll be happy to address that, Mr. Karantonis. Testing has its place, but I have to remind people a negative test result does not give you carte blanche to, when you visit your family or friends, to suddenly come within 6 foot distances of each other, okay? It's a risk you can decide to take, but the test result at that moment is about what your experience was. So if it was negative on that day that you tested, it doesn't mean you couldn't go on to have a test positive result or symptoms on subsequent days if you had been exposed previously. So like we say, whatever you do here, and hopefully you're doing all the things we're recommending that you do, you maintain 6 foot distances with people outside of your household. So I would recommend people still enjoy Thanksgiving, but it may be on a smaller scale because unless you've been sharing the same household bubble with everyone. Okay, because the ability to pass germs still is there. So testing is part of the larger public health strategy, but it's really on an individual basis. Obviously, if you have a positive test result, you should stay home. The negative result should just allow you to say, okay, on that day that I wasn't positive, and it doesn't mean you can suddenly be close to each other with people who have not been living in your household. 6 foot distances. When I'm planning my husband's 50th birthday party, it's going to be with maybe 2 people, and we're going to be 6 foot distances or greater even at that moment, because it's important to still protect the health at those times.
Okay, thank you. We have a lot of questions in the chat about Arlington Public Schools, as it would be expected. And I want to let everybody know, in case it's not clear, there will be a town hall conducted by APS and its relatively new superintendent, Dr. Francisco Duran, tonight at 5:00 p.m., where questions about APS's plan for reopening should be addressed, because those are decisions that are made by Arlington Public Schools under the authority of the superintendent as the chief executive officer and the elected school board as the governing body. But that said, as many people are wondering, what is the county doing to support APS in terms of facilitating a return to reopening, which clearly is the undercurrent of many concerns? I'll just share in full disclosure, I'm a parent of 2 school-aged children. And while I very much want them to go and return to school in person as quickly as possible, I recognize that there are many other students in the county, whether it be their early elementary age status, their status as English language learners, or having other special needs, or being disabled, very much requires that they get in-person instruction as soon as possible. That is a goal that I have. But the school system is the body that will effectuate all of that. And I realize that there's a lot lot of questions about that. But why don't we focus on what it is that the county has done to help the schools determine, how to safely implement a return to school. So, Dr. Varghese, maybe you want to speak about the consultative role that you play with Arlington Public Schools, and specifically, maybe we can address, is there a way that testing capacity can be made available to schools that could support their reopening plan?
Sure, happy to address what we've been doing. So our role in COVID is the same role that we've had prior to COVID. We have, as a public health department, we have always provided guidance on how to reduce exposure risk, which is what I think people have to remember. The primary purpose of public health is on communicable diseases. How do we prevent exposures from occurring? That is the primary role of public health. We actually did not make the recommendation to open or close. We actually have no statutory authority for those sorts of things. Having said that, the primary goal is to work hand in glove with the schools to help them understand so that they can make sure parents, staff, and students are best protected to reduce exposure. So the same things people have heard me talk about that for the county and its residents applies also to the schools. We are, as a region and as the Virginia Department of Health, we continue to emphasize that maintaining 6-foot distances is the best way to prevent exposures, along with wearing at least cloth face coverings and staying home if you're ill. It is, we know it's sometimes hard to keep kids at home if you have to work, but this is even a more important time that if there's any fever or any sickness, that children, whenever schools reopen, stay at home. Washing hands, covering coughs, teaching all of those things are very important activities. And so our school health bureau is working with the emergency manager in Arlington Public Schools to make sure that the clinics are staffed appropriately. If there's consultation on isolation rooms when children get sick, those things we're providing our expertise so that they can make the decisions that make the most important sense for Arlington Public Schools. And their website has very good information. And as a reminder, they're looking not only at health metrics, they're also looking at operational metrics. Do they have the staff support and safety to be able to open things safely and keep things safe? Did I address everything in the question, Mr. Dorsey? I think I got on a roll, so I may have.
Let's see. Testing, yes.
Yeah. And so we've even provided information about resources where they can partner with folks about how to do testing as part of the strategy. But one of the things, this is the same thing, we recommend that parents work with their child's doctors to make sure, first of all, that it's not just an issue of is it COVID or not. That's an important question, but there are other things that can occur other than COVID. We're entering flu season, strep throat. All of those things are still communicable diseases that we do not want to enter into the schools. So we don't recommend just COVID testing blanketly. It's if your child is ill, do you know what the diagnosis is before they're going to return to school? So proving that it's not COVID is only one of the aspects. If there are things that are unusual, we need parents to work with their providers to make sure it's understood what it is that's happening, because we don't need an outbreak of flu in the school just as much as we don't want an outbreak of COVID in the schools.
It's an interesting consideration. So just not to put words in your mouth, just to make sure we're communicating guidance clearly. So for schools, the key thing is really being attuned to symptoms in children and making decisions accordingly, whether it be first keeping people away from school if we were to reopen, if there are any symptoms at all, and then being sure to seek healthcare guidance, whether it's COVID, flu, or something else, but really being attuned to symptoms. So I got it. Okay. All right.
Well said.
All right. And just to make sure everyone is clear, and Dr. Varghese, please correct if I say this incorrectly, it's not Arlington County which is determining whether schools open or when they reopen. Your role is to provide guidance for them to implement, but ultimately they determine whether they accept your guidance, whether they do something more than what you recommend or less than what you recommend.
Correct, and that's true for the entire state. Public health really just provides the expertise to help interpret the things that CDC or puts out, or VDH, or we then may put out to help reduce exposure risk. There is no authority to open or close. People are often surprised by that, but my authority really actually extends only to a limited number of places, but most of it's by recommendation. And so all schools can make the decision across the Commonwealth and across the nation on whether to open or not, just as much as we as a county decide how open or closed we may be, depending on what the risks are and operational needs are.
Thank you. And before we leave that, since you brought up the prevalence of flu this season, for people who are insured, you see it widely advertised that free flu shots are available. Do we have any specific programs for people who are not insured or adequately insured to provide access for low cost or free flu shots?
It's a good question. We do have some availability in our clinics for the programs we do have, and we're looking to see if we can expand it. Having said that, one of the things that we do know is that our communities are fairly resilient, and there are opportunities for people to get flu shots throughout the region, including at pharmacies and so on. So we still, even our uninsured, underinsured, often will go after that. We're just trying to figure out a way to make it convenient for them. The problem is we have to also, because of our COVID response, it's changed our system of care in general, because we're trying to protect the entire community with the existing public health resources.
Thank you.
And Dr. Varghese, it is definitely a very good idea and a strong recommendation for people to have their flu shots, right?
Correct.
And if they need a free flu shots, they can still call us, and we can find some solution. I always remember the Arlington Free Clinic annual flu shot drives that they were very well visited.
Right. But they also have to be able to actually have the staffing to do it. That's the thing that's a little bit different this year compared to other years. We just can't always assure that the same systems are in place. So that's why we're trying to figure out, can we do it and balance it with the needs of COVID response in general. So we will help them find, and there's always the Flu Finder app that we'll put in the chat box where people can know where flu shots can be gotten, obviously for either insured or for a fee.
Absolutely, and thank you so much for the support that you provide to the Arlington Public School System. It's not only the health related aspects of decision making there. There are also significant aspects that are technical contingency planning. What happens if a kid falls? If we have an outbreak, we have seen we have already experienced with other school systems that opened or took some risks, and we know for what we have to be, for the complexity of things that we have to be prepared. So I think it will be a very interesting town hall with Dr. Duran later today. So not unrelated question, and not completely unrelated, but this time under our full jurisdiction. The question is, can you please share the metrics you're looking to hit before libraries reopen? Libraries in neighboring jurisdictions have opened. They provide vital services, and it's unclear why other areas are opening their branches, but Arlingtonians are not receiving those services. I have received this kind of questions recently, several times from constituents, from neighbors. I have to say, this is a goal to try to make library service progressively more available to everybody, especially to kids who need to see and maybe browse the picture books. One thing I would say that it is not exactly correct that libraries do not provide services to Arlingtonians right now. And as a matter of fact, because of this conversation about when we can get to the proper staffing level and solve the logistical questions that are needed to be solved in order to allow for for limited browsing, for controlled, safe browsing in our public libraries or in specific locations. I've been told by the by our leading staff there that since mid-June, more than 140,000 books have been already being distributed. More than 3,000 unique, distinct users are served. So I think that the library staff is doing a very, very thorough work, and I have to commend them for that. Now, really, from what I've been told, and I invite staff to weigh in on that, it is basically a question of returning to appropriate staffing levels, being able to fund this among the many, many competing priorities right now with emergency response. We are committed. We have a plan to try to open at least 2 locations. There was a discussion about Westover and Shirlington, where limited browsing will be allowed again soon. We are working on this, but I don't know if staff or my colleague, Mr. Dorsey, wants to weigh in on this question as well.
Yeah, we're not joined by County Manager Schwartz, who would probably be best to weigh in from a staff perspective. But in terms of our direction, Mr. Karantonis, I think you hit all of the right notes. This is something that we hear and understand, that libraries are providing, we're missing not having the libraries providing the critical resources that they do. It's really an issue, I would say, even more than funding. It is an issue of staff availability and making sure that we can safely provide for the safety of all who may want to enjoy limited browsing. That is where we are doing it thoughtfully. And as some of you may know, if you followed these chats before, many of the staff that were devoted to the library division have been engaged in our contact tracing efforts, which continue as long as spread continues. So that is why we don't have the full complement of everyone who could work to effectuate a good plan for browsing in libraries. But as Mr. Karantonis said, for those who are able, the resources for circulation are robust, and we hope that you can take advantage of them until the browsing comes online.
Yeah, but we definitely understand that, especially for kids, which is where that was the center of the comments and input that we got from constituents, that it's important to be able to go back and be able to browse, actually, the picture, or physically browse this picture. We are working on this. So what would be the next question, Mr. Dorsey?
Oh my God, yeah, we've got a lot. So why don't we move next to just a couple of questions that we could address quickly regarding contact tracing. There are people who are wondering whether or not there is still a need for people to be recruited for that effort, and if so, how might one go about expressing their interest?
I'll be happy to take that, Mr. Dorsey. We actually had a very robust response from the community in the region for our contact tracing opportunities. And so we're actually in the process of interviewing those individuals. And I need to make sure people realize we actually have had a robust contact tracing program. What we're trying to do is take out some of the public health staff so I can move them towards other aspects of COVID response, as if when we're doing with vaccine planning and distribution when that happens. So we need others to come in and fill. And so those positions are being recruited for. If I remember at the last count, they had over 700 people that applied. So I hate to disappoint folks, but I would say let's first see how the dust settles and make sure that we have it adequately staffed. If obviously they didn't find the appropriate folks, we will continue to provide the public health staff till that can be re-advertised. But it looks like it's going in the right direction to have good people to take over for a number of the public health staff so we can shift them to other aspects of COVID response as that happens.
Thank you. And we've spoken on this before, but I think it bears repeating given some of the questions that we're receiving about, why is it that libraries and schools, which implicitly, and I agree, are essential community functions, why are they closed while gyms and bars, restaurants remain open. And I just want to reiterate, and I want everyone to understand that this is not about passing the buck, but we have authority to determine whether we open libraries, and APS has authority to determine when we open schools. In terms of other businesses that are not directly permitted to be closed or reopened under our own initiative, they're subject to state guidelines, and the state has allowed, under certain conditions, for them to be able to operate. And we are responsible for ensuring that they do so within the orders offered by the governor. And Dr. Varghese and his staff vigilantly monitor them for compliance, but only if they run afoul of state requirements are we allowed to take any action that ceases letting them operate. So it's just two separate areas of authority, and hopefully that's clear, but we invite any other questions if you have specific ones about that. We also have some questions coming in about what we're doing to really deal with other issues not directly related to people who become COVID positive, but really the ancillary effects. What are we doing about the emotional and behavioral health concerns that may arise? And specifically, people are concerned about depression, maybe suicide rates, domestic abuse. So we've discussed this in previous town halls about all of the ways in which we have supports in these areas, but I don't know if anyone can speak specifically about where we can refer people to get a full complement of the resources that are available here. If Ms. Helfer is still on, I think you can refer to the robust COVID web pages that we have on our website. Who can, maybe not.
Yes, I apologize. I am here. Yeah, we will get that information in the chat box. There are some really good 800 numbers that people can call for a very quick emergency. Like if you're in crisis, we will put all those crisis hotlines up into the chat box to make sure that people really do have that information in front of them. And let me just get that and we'll get it out to everyone. But it's important that if you find someone in crisis, to call the hotline, or if someone's in immediate crisis, 911 is really important. So we want to take care of our residents. And Aaron or Ruben, if you want to add anything to that, please.
Sure. No, I mean, I think what we have to know is we're using our traditional Department of Human Services resources, and I know the staff have been working to support people, whether it's domestic violence. One of the things we are aware of is that as you ask people to stay at home, you may be having people having to stay in close contact with abusers, which is obviously not a thing that we want to do. And so that's why the resources are available. Behavioral Health Care Division has been working on making sure that they have resources for, once again, the underserved populations that may be at risk for behavioral health care needs. So Brian, when you have that ability to put that, maybe more than just the chat box, we may need to say the actual telephone number on the town hall as well. So.
Indeed. And as part of that, we've had organizations that we've partnered with, for example, Doorways for Women and Families, who is very much a leader in providing services to survivors of domestic abuse. And we have worked where possible to increase the capacity of those organizations to serve people who are having those critical needs. But if there's any way in which you or anyone that you are connected to is in need of help, hopefully we can provide some good contact resources so that you can seek it out, because I believe it will be available.
Yeah, so Christian, the domestic violence hotline is 703-237-0881. And if you call that, if someone is in need, you can always call for Child Protective Services, 228-1500. And elder abuse is 228-1700. But you can always call, 7999, 228-7999, or 1300. I'm throwing out a lot of numbers because there are different hotlines for everything. But again, if someone's in immediate crisis, please call 911. The domestic violence hotline is 237-0881. And any of those can help you get to an emergency help. So I hope that is helpful.
Thanks. Thank you. And Dr. Varghese, if you could just speak a little bit about the contact tracing efforts and what you have learned in terms of where the virus is spreading. What are the true trouble spots for you? I mean, we always talk about congregating facilities like bars and restaurants, but are there any other areas that you have identified from the specific contact tracing that you've done, without, of course, violating any patient confidentiality, of where we need to be vigilant or concerned with?
Sure. Great question. We have known for a long time that if a virus gets trapped in certain settings, say like a nursing home, that would be a ready place for germ spread to occur, because they need a lot of assistance with activities of daily living, which requires another person to come in contact with the resident, and so germ transmission is possible. There's been no specific pattern that we can find with any particular businesses and so on. But what we do know is that as we've allowed as a Commonwealth, it wasn't for public health reasons, but trying to reopen society, the governor back in July said, groups of 250 or less could come together. So it's just a habit of when we are allowed to leave our homes and congregate more, the ability to pass germs in certain settings has increased. CDC has noted that, and all we can say is correlation, not causation, but a number of the people across the nation who are reporting contacts outside of their home, it has been in places like restaurants and bars, because it's a different sort of congregate sort of setting, and that's possible. So once again, the more you can be careful in those settings. But remember, people also go to grocery stores. So typically people aren't dining in a grocery store, but once again, think about protecting the workers who are in those facilities. That's why you're wearing the face covering, because you may not be at risk for the exposure, but every single person that the cashier comes in contact with over time, however good they're taking precautions, they can't protect against every single exposure. We're the source of exposure more for them than they are for us. So that's why the more we can do this to protect each other, that's why face coverings are important, to protect others from our germs. So.
Thank you.
A couple of quick technical questions that I think it's always good to provide clarity here. We have a question about the Quincy Street testing location. So if somebody doesn't own a car and is insured and just walks to the Quincy Street testing site, is there any problem? He or she will have the test administered, right? Correct, Dr. Miller?
So we'd ask that when you are making an appointment, that we can be able to safely accommodate you for that, because we've got cars moving through the area. We want to make sure that obviously a pedestrian car interaction would be the worst thing we can have happen. So we want to make sure everybody is safe. The other thing I'll point you to, if you have a vehicle, you don't have a vehicle and you are insured, there are a number of other options for you to receive a test, including home-based kits, which can be mailed right to your door, sampled in the privacy of your home, and then sent back for analysis so you can receive private results. Those options are also posted on our website. The Dr. Varghese and the Public Health Department have looked at those, and they are also assessed by the Virginia Department of Health to ensure that they meet the standards of the CDC. So those are all CDC registered tests, and that is another way to increase availability, particularly if you don't have transportation but do have insurance to get access to those.
Okay, different question here. What protections are in place for Arlington's foster care population? Are there plans to continue foster family outreach and make sure that foster families and children are children in care and their care are safe?
While I don't know the specifics, I know the guidance that we've provided from the very beginning has been shared with our Child and Family Services Division and their staff, and they work with the families and the foster children to provide the most protection that are possible and to be able to get the fostering work actually accomplished at the same time. That's the most I could answer on that.
Okay. So,
yeah,
go ahead, Doctor. Go ahead. Well, just the quick one about people looking forward to hopefully with optimism when a vaccine might be available. And if Dr. Varghese, Dr. Miller, you could share what might a deployment plan to ensure that as many people can be vaccinated as quickly as possible, provided one meets your recommendation for being safe and effective.
Sure. Happy to talk about what we know about vaccine at this point. There are several vaccines under development under U.S. auspices and across the world. And what we're looking to see is which ones will be officially authorized by the FDA, assuming that the independent groups believe it's safe and effective, they'll be offered. The initial plan would be there'll be very limited supply, and that would actually be directed towards individuals who are healthcare workers in hospital settings and folks like EMS to make sure that we can reduce their exposure risk to keep the essential functions operating. One of the things people need to recognize is most of these vaccines are 2 doses, and they have to be separated by 21 to 28 days, and you can't mix and match the vaccines. So if you start with vaccine A and the next one that comes around is vaccine C, you have to wait till vaccine A supply is available to have that done. So it's going to be a vaccine puzzle, Rubik's Cube that not just Arlington, but the whole nation is going to have to be playing. I think eventually everything will be working out, but we're trying to recruit both the private sector and we're planning for a government approach. Obviously, there will actually be initially prioritization that will be set by CDC of which groups to prioritize. We don't have anything officially that's been determined. And then we're going to ask people to cooperate with that because there's a reason why there will be recommendations of which groups should be prioritized before others. And I'm just going to make sure, even if we had enough for 200,000 people, we cannot deliver all 200,000 doses in one day. There will have to be a plan to do this in the safe way and deliver it at 6-foot distances and repeating the doses. And the thing that people need to be aware of, because we don't know about the long-term effectiveness. We know short-term effectiveness, but long-term, we will still be advising 6-foot distances, face coverings, because we need to be able to prove that it is actually going to work long-term. It is not a fault of the vaccine makers to be able to say that they can't determine that it's long-term effectiveness. That's how all other vaccines are determined. It's over time, and we will not have had the experience with this to be able to know that. And yet we have to balance if this can actually help reduce the risk of further transmission. It's a reasonable thing to consider. Aaron?
Yeah, Mr. Dorsey, I just want to add, so I see some questions in the chat box about vaccine safety and about a few other logistics associated with this. Briefly, the governor has established as part of the Unified Command Group, and so that is at the state level, the departments and agencies that are managing COVID have also created a vaccine task force. We do have happen to be lucky because we have a representative on that vaccine task force and advising to some of the implementation and planning of this effort. And so to Dr. Varghese's point, this is a fairly complex effort, and we're looking at everything on the logistics side as cold chain management, as to how we administer this both publicly and privately, like you said. tracking of individuals. Obviously, we have to know which one you get and be able to pass that back to the Virginia Department of Health. So there are a lot of large lifts in this, creating a system essentially that has never before been created and purposed to do this, right? So I want to emphasize that. As far as safety goes, yes, the Virginia Department of Health, the health commissioner, as well as Dr. Varghese, all will advise on the vaccine safety, reviewing it, and provide the appropriate public health and clinical guidance.
Okay. By my count, Mr. Karantonis, unless you have something, I think we have addressed the universe of questions, maybe not specifically to everyone's satisfaction, certainly, but I think we've addressed pretty much everything. So we should probably wrap up our conversation this afternoon. What do you think?
I think that we can. Since we had Dr. Miller still there, somebody asked what is the turnaround time currently for testing as we provided in Arlington, the average?
Yeah, so we're still between a 3 and 4 day turnaround on the general testing. That's at the outside. That's on the maximum. We're seeing much more in the 48-hour mark. That is the average that we're seeing across the Commonwealth and across the country for those what we're calling outpatient tests. The only thing that's quicker than that is inpatient laboratory services at hospitals, hospital-based testing for critical cases.
Thank you. So I believe we can wrap up this town hall. We will continue with these town halls. So this is an absolute commitment. I believe that they are providing a lot of information and in a forum where residents can ask us what's going on and be very specific. But I remind everybody that there are many ways to place these questions, to bring up issues, to highlight issues, especially since we were talking about equity today, and we've seen how disproportionately certain the Hispanic community, the Black and Brown community is affected, are affected. I may also point out and thank staff for supporting this, that we had also a similar town hall exclusively in the Spanish language. We will be back with that. Ms. Helfer, help me if I'm wrong with the date. I believe that we are planning right now October the 28th for this. It will be an evening. It will be properly announced.
Correct. That is correct.
Okay. So we will continue to pay a lot of attention to those who have been impacted the most, to everything that's related to COVID, but those who have been impacted the most, and we will, and I think that we will be relentless in trying to normalize the impact to these communities, both the impact on their health, but as well all the other impacts that are related to that, to their economic stability, to their housing, etc. All these problems are continuing. We still have extreme eviction stress on families. We have extreme employment stress on families. A lot of people have lost their jobs. They continue to be unemployed, or their employment conditions are very precarious. Small businesses are suffering. This is really a complicated recovery effort, stabilization and recovery effort under very difficult conditions as the pandemic is ongoing. So we are again in this all together, which means your government will be doing its darnest to address every issue that's related to COVID and comes to us. But on the other side, I want really to implore everybody to do their part. That is, keep the social distancing. Really try your best to social distance, especially now in the a colder season, it's not so easy. Secondly, the face coverings. Put on the mask whenever you can, when you're outside. This is really very important. It is very helpful, and I believe that a lot of our success so far to be very different than other places in the nation in terms of having been impacted by COVID has a lot to do with the adherence, the voluntary adherence of many Arlingtonians to putting on their mask and continue to protect themselves and others. And the third is to observe the hygiene. Remember this thing about washing your hands and try to keep your homes, your workplaces as safe as possible. So thank you again. Thank you, staff. And I will pass this to my colleague, Christian Dorsey, for final remarks.
Well, thank you, Mr. Karantonis, and very much appreciate the opportunity to conduct this with you. My first time doing it with you, and I look forward to future opportunities. And, for everyone, I realized that we couldn't get to every specific dimension of a question that was asked today. So I would advise everyone to bookmark and refer frequently to Arlington's web resources on COVID-19, which can include specific information like links to guidance for particular sectors that's available through the governor's office, as well as specific questions about antigen testing in our local community, as well as just about every other thing that I think you could possibly be concerned with. And if it's not there, there will be contact information for how you can get that specific question answered. And that can be found at arlingtonva.us/COVID-19. And, for other people who may have more personal information or need help that's not immediately available with the web resources, we encourage you to call 703-228-7999. This has become so apparent to everyone that we're all affected by this, but in many, many different ways. And we give guidance about the best way to control the pandemic spread, and we realize that guidance very much is not able to be practiced by everyone, because there are people in our community who don't have the option of staying home and must be engaged in work to support their families, who are juggling household responsibilities that are incredibly complex. So to the extent that we can, we want to understand what we can do and if we as local government can respond to those specific needs, because we recognize that the guidance will disproportionately be able to be followed by some, but certainly not all. And we want to help and make sure everyone can get through this pandemic as safely as possible, because we do know that we want to get back to normal as soon as possible. And I realize that the answers about schools don't satisfy everyone, but I do encourage people to take those same questions and take them to the town hall that will be conducted this evening by Arlington Public Schools. That'll be at 5:00 p.m. And hopefully, if you are able to forward your questions then, you will be able to get detailed responses in that venue. So I think that's it.
Yes, and thanks
Be well and be
to
safe,
Arlington
everyone.
County staff and to everybody who participated today in this town hall. Till the next one.